Good morning, everyone. Thank you for joining us to discuss this critically important issue to establish a national strategy on brain injuries. My name is Gord. I'm the federal NDP critic for health and the Member of Parliament for Courtenay-Alberni. I'm very pleased to be joined today by Michelle McDonald, who's the CEO of Brain Injury Canada, and Janelle Breeze-Biagoni, who's the Executive Director of the BC Brain Injury Association and Community Lead on the National Strategy. Back in June, I tabled Bill C-206, an act to establish a national strategy on brain injuries. And I really want to thank these two incredible people sharing the stage with me today, as this bill was very much developed in direction with consultation with them. Today, we're also joined by many stakeholders and advocates from across the country, far too many to fit on this stage with us, who are meeting with members of Parliament on Parliament Hill and senators to impress upon all parliamentarians the need for more services and support for brain injury at all stages of recovery. Bill C-206 requires the Minister of Health to develop a strategy to support and improve brain injury awareness, prevention, and treatment, as well as improving the rehabilitation and recovery of people living with a brain injury. The strategy would also require consultation with provincial and territorial governments responsible for health, Indigenous people and Indigenous groups, and relevant stakeholders. The strategy requires a number of things, including the implementation of preventative measures, identifying the training, education, and guidance needs of healthcare professionals, and identify the challenges resulting from brain injury, such as mental health problems, addiction, housing and homelessness issues, and criminality. The bill would also have reporting requirements so that Parliament can keep tabs on this strategy. I'd also like to acknowledge the great work done by my former NDP colleague, Alistair McGregor, the past Member of Parliament for Couch and Malahat Langford, who introduced this bill in two previous parliaments. Alistair's last attempt at making a national strategy on a reality, then Bill C-277, passed second reading with a unanimous vote in the previous Parliament, supported by all parliamentarians. And were it not for delays with House business in the fall of 2024, it would have likely been enacted by now. So this issue is completely nonpartisan, as demonstrated by the overwhelming support for it by all parties in the previous Parliament. I'd therefore like to encourage all members of Parliament and senators to support Bill C-206 to finally enact a national strategy on brain injuries. And it's an honor to right now pass things over to Michelle McDonald from Brain Injury Canada to say a few words. Michelle.
Thank you, MP Johns. Brain injury is the issue Canada isn't talking about, yet it cuts directly across some of the most urgent social challenges facing our country. Brain injury can transform every part of a person's life, their independence, abilities, employment, relationships, and sense of connection to their community. While an outdated statistic suggests 1.5 million Canadians live with the effects of brain injury, the true number is far higher. Brain injury is rarely a single event, yet is often the beginning of a lifelong chronic condition. And although medical advances now save more lives after severe injury, our healthcare and social systems are not built to support people in the years and decades that follow. Many people with brain injuries fall through the cracks. Others live stable lives, but still cannot access the services, accommodation, and supports needed to live well. The hidden nature of brain injury only compounds the problem, leading to stigma, misunderstanding, and isolation. Brain injury is connected to so many of the challenges we talk about every day in Canada. It doesn't occur in isolation. Its impacts are shaped by factors like housing insecurity, mental health, employment, substance use, violence, and systemic inequities. It both influences and is influenced by these conditions, creating complex cycles that disproportionately affect marginalized and underserved communities. Understand brain injury means understanding how it intersects with the broader social challenges Canadians face every day. Despite this profound impact, Canada has no coordinated national approach to prevention, treatment, rehabilitation, or long-term support. Acute long-term data, which is the foundation of effective policy, remains largely absent. This lack of information prevents us from understanding the true scope or need or designing the systems required to meet it. A national strategy would finally enable consistent data collection, better healthcare tracking, and evidence-based policy development across provinces and territories. This is a non-partisan issue. Brain injury affects every Canadians of every age, background, and political affiliation. It affects families in every riding. The need for coordinated action transcends party lines, and Canadians are looking to all members of Parliament and senators to work together to make a national strategy a reality. This is an opportunity for Parliament to demonstrate unity, leadership, and a commitment to the well-being of millions of Canadians now and for generations to come. Investing in a national brain injury strategy is both a moral imperative and a smart economic choice. It would save lives, reduce suffering, and improve outcomes across housing, mental health, employment, substance use, and violence prevention. Canada needs a national strategy on brain injury so every person has the opportunity not only to survive, but to recover, rebuild, and thrive.
Thank you, Michelle and MP Johns. Good afternoon. As you know, my name is Janelle, and I have the privilege of serving as the Executive Director of the BC Brain Injury Association. I'm also the CEO and founder of the Constable Gerald Breeze Centre for Traumatic Life Losses, which I formed in 2016 in memory of my husband who suffered a traumatic brain injury in a duty-related accident in Penticton as an RCMP motorcycle officer, and began pursuing a national strategy then. So it's been 9 years in the works for me. I'm also the community lead on the BC Consensus Statement on Brain Injury, Mental Health and Addiction, which was the first ever statement made in the country. And as MP John said, the lead on the National Strategy on Brain Injury. So since my husband's death for more than 35 years, I have now walked along survivors, families, clinicians, researchers, and community partners across Canada. And through all of those years, listening and learning their stories, one message has become absolutely clear, which is brain injury is not only a health issue, it is a human rights issue. Every day, we learn about people whose brain injuries come through the front door of our medical system. The person who sustains a brain injury after an overdose. The woman living with traumatic brain injuries caused by intimate partner violence. The individual navigating homelessness whose injuries accumulate over years of survival. Because they did not enter through the system or through the right door, and because our systems are fragmented, they are left behind. They are invisible in data, they're excluded from services, and denied the supports that every Canadian should have access to. This is a human rights failure. It should not depend on your postal code if you get served. A person's ability to access assessment, rehabilitation, housing, or long-term supports should never depend on whether their injury occurred in a hospital, in an alleyway, or behind closed doors, and it should never depend on their address. This is exactly why the advancement of Bill C-206, the National Strategy on Brain Injury Act, cannot wait any longer. We need national leadership, coordinated action, and a unified strategy that ensures survivors and families receive care no matter where they live or how their injury occurred. Through the BC Consensus on Brain Injury, Mental Health and Addiction, leaders from every sector, health, justice, housing, Indigenous organizations, academia, lived experience, and community for the past 4 years have been incredibly clear. We need a strategy, we need a consistency across the country, and we need this action now. Survivors and families cannot wait any longer. They cannot wait for another report, another pilot project, or another election cycle. They need us to move Bill C-206 forward immediately so that no one living with the impact of brain injury is left behind. So today I ask everyone to stand together with us, to stand with the survivors and their family members, to stand for equity, to stand for the fundamental human right to access care and support in this country. Thank you. Let's move this forward together.
Before we take questions, I just want to thank Janelle and Michelle for and the survivors and their families for their incredible courage and determination to fight for a national strategy, and hope that all parliamentarians will come together and support their ask. This is, again, a nonpartisan issue.